name is Dana McCormac and I'll be demonstrating an IM injection. So it is February 7th, 2021 at 20:30. I'm comparing the physician sheet to my MAR. So I have nursing, Jake, 312, 654, 987, January 1st, 1960, January 1st, 1960. No known allergies. We're giving diamond hydronate, 150 milligrams, IM, daily, so February 7th at 2100, that has not been given yet. And this is double signed as well as this is double signed. So I'm going to wash my hands and get my medication. So I have diamond hydronate, 150 milligrams. This comes in 50 milligrams per milliliter, so I'll be giving 3 milliliters. It is to be given IM. This says IM and daily, February 7th at 2100, that hasn't been given yet, as well as this is not expired. So I'll check the drug monograph. This is diamond hydronate, as well as this is diamond hydronate, and it is an antiemetic. A student nurse can give this injection, and the maximum single dose is 100 milligrams, and our dose is 150. At this point, I would call the physician and clarify that they would like me to give the 150 milligrams of diamond hydronate IM, and they said that they would, so I'll be going forward with this injection. And it does say here that it can be given IM, so I will set that aside. I'm going to wash my hands and get an alcohol swab and swab the top of my vial for 30 seconds. And while that dries, I will get my blunt fill needle, my 3 milliliter syringe, and my 22 gauge and 1.5 inch injection needle. So I will open my sterile syringe and get my sterile blunt fill. And we need 3 milliliters, so I will get 3 milliliters of air in my syringe and inject 3 milliliters of air into my vial to get 3 milliliters of medication . So I will recap my needle and I will get out any bubbles . I'll make sure that all of the medication is out of the blunt fill needle and discard it in sharps and attach my injection needle, which is also sterile. I would fill to the 3 milliliter mark so that there is a bleb at the top, and I will not leave my medication unattended, but I will show you my syringe is at the 3 milliliter mark. And so now that I have my medication, I will make my label. So this is for nursing Jake, and this is diamond hydronate. Our dose is 150 milligrams IM, and our volume is 3 milliliters. Our concentration was 50 milligrams per milliliter, and it is February 7th, 2021 at 2100, and that is my signature. Again, I wouldn't leave my medication unattended, but I will show you my label. So now that I have my label and my medication, I'm going to do my third check. So I have my second check, sorry. Nursing Jake, diamond hydronate, 150 milligrams. This concentration is 50 milligrams per milliliter, so I'll need 3 milliliters, which is what I have here. It has to be given IM. This can be given IM, and this is IM. And it is to be given daily, February 7th at 2100. That has not been given yet, so we can give that. And again, we clarified the 150 milligrams, and this is not expired, so I'll set that aside. Now that I've done my second check, I'll get all the supplies I need to go to the patient's room. So I have a pen, a cotton ball, my drug card, an alcohol swab, and my gloves. I'm going to go to my room. I'm going to do my entrance safety check, wash my hands, and introduce myself. Hello, my name is Dana McCormac, and I'll be your student nurse for today. Can I check your wristband, and can you tell me your full name and your birthday? Good, so nursing, Jake, 312-312-654-654, 987-987, January 1st, 1960, January 1st, 1960. And do you have any allergies? No? Good. Okay, so I'm going to do my third check, and then I'll be right with you. Is that okay? Good. So I have nursing Jake, we verified this is nursing Jake. Diamond hydronate, 150 milligrams, 150 milligrams. The concentration was 50 milligrams per milliliter. So I have 3 milliliters here to get my 150 milligrams. It is to be given IM. This is an IM injection needle, and this medication can be given IM. This will be given daily, so February 7th at 2100. That has not been given yet, so we can give that. So now I'm going to wash my hands again, and I'm going to do my patient education. So Jake, this medication is an antiemetic. It is diamond hydronate, and it is for your nausea and vomiting that you've been experiencing from your chemotherapy. So some side effects that you can experience with this is drowsiness, dizziness, and headache. And so is it okay if I give you this medication? Yeah, good. And beforehand, I did take your vital signs, specifically your blood pressure and your temperature, because this medication can affect that, and you are in the safe range to give. So I will raise the height of the bed, and I will wash my hands again and locate my site. So I will be giving this medication in the ventrogluteal muscle. So I'll have the palm of my hand on the greater trochanter, the thumb towards the groin, the index finger towards the iliac spine, and the middle finger towards the iliac crest, and I'll be injecting in between my index and middle finger for the ventrogluteal muscle. So now that I've located my site, I'm going to wash my hands and put on my gloves. And I will swab the site for 30 seconds with an alcohol swab in a circular motion. I'll let that dry. Some sites do require IM injections to aspirate beforehand, but this location does not, so I will not be aspirating. I will Z-track and inject at 90 degrees, stabilize, and inject the medication slowly. I'll wait a couple seconds and remove the needle and remove my hand. I'll use the safety, I will activate the safety mechanism and put that in the sharps container, and I will put a cotton ball on the injection site to stop any bleeding. I will take off my gloves, perform hand hygiene, and I will document. So February 7th at 2100, I am DMUMSN2. So Jake, again, this medication can give you some dizziness, drowsiness, and headache. So I will be back to check if you're having any of those side effects as well. You can use the call bell that I've left for you here if you do experience those, or if you need anything. I will be back in about an hour to check your vital signs, specifically your temperature and your blood pressure. Do you have any questions? No? Okay, so I'm going to lower the bed. You do have your call bell here, and as I leave, I will do my exit safety check, and the patient is safe.